Good.
Hello, I'm Dr. Steve Shirley. I'm the Clinic Director of the Spinal and Sports Care Clinic. And we're here today to talk about spinal degeneration, or the medical diagnosis of osteoarthritis or degenerative disc disease. What we're going to do is use this chart to show you the three different phases of spinal degeneration. This is a common condition we see in our clinic, and while chiropractic care can't stop entirely the progression of degenerative disc disease, it can certainly slow it down and make people with this diagnosis feel quite a bit better. So we're going to look at this chart here, and I'm just going to walk you through the degeneration. This here is an x-ray of the neck, and this is from the side. And what you see are the individual vertebrae stacked on top of each other. The first thing you notice is a gentle sweeping curve towards the front, and that's called the normal curvature of the spine. Now, due to poor posture and injury and trauma, over a period of time, if this gets altered at all, you enter what's called phase 1 or mild or early degenerative arthritis. Now, you can see in this picture here, of the same picture of the neck in a different individual, the curve has been lost, or you see straightening of the spine. And this is what we see commonly in practice with people who have misalignments in their neck, where they have stiffness and pain, and their x-rays show there's the beginning of changes in terms of the curve of their neck. The next stage is what's called phase 2, is if we come down to here, shows someone who's had this condition for a longer period of time and has progressed. What we see on x-ray that progressed, these are the disc spaces that you can see, and these are relatively normal. And at these two joints here, and these two vertebrae, the disc space is narrowed, and we see lipping here that has been caused from this going on for a long period of time. In chiropractic, we try to catch this problem before it gets to this stage, and we found that we restore the mechanics to this joint by improving the motion, the degenerative change won't progress. Now, if this goes left untreated and continues on, then you get to what we call phase 3 in degeneration, or advanced osteoarthritis, or advanced degenerative disc disease. You can see that the bone spurs are much more extensive, and the body's actually trying to fuse these joints together. This is one reason that people who have a lot of arthritis are very stiff and they can't bend. Their joints are literally fusing as the disc spaces start to merge together, and you end up with bone on bone. Now, chiropractic care is effective for any of these conditions, and we find it obviously more challenging to treat when people are in phase 3. But what we find is that by the earlier you catch this problem and restore the normal mechanics, then you can stop this process from progressing and eventually have better long-term outcomes in terms of not feeling so old and so stiff as you get older. If you have any more questions about this, feel free to call us at the Spinal and Sports Care Clinic in Spokane Valley, Washington. Have a good day.